Kim, thank you so much for taking some time today. Maybe a good place to start would just be letting us know a little bit about yourself, organization, role. That would be great.
Sure. I'm Kim Rudowski, a nurse by training with a business degree. I'm the Corporate Compliance Officer for Exalt Health. We are inpatient rehabs. We are in growth mode, so we aspire to have 15 to 20 hospitals within the next 3 to 4 years. We have one that's currently open as of middle of August, and soon to have our second one open in middle of November.
That's a lot of growth.
It is, and it's a lot of fun.
Yeah, just before the camera was rolling, you were telling me about all the things that you've been doing with regards to the growth of the organization, which is really quite amazing. What are the key market dynamics that are fueling that growth? And how should other healthcare organizations rethink their approach to post-acute care, considering the trends in that approach?
I think for us, what has worked historically and what continues to be our great playbook is that we take global ideas, market framework issues, and then we make it local. You can't have a one-size-fits-all in the post-acute space. What works in New York doesn't work in LA. And so for us, we find local partners. Our physicians are local. We don't have national representatives. And we really work with our physicians, our medical staff, our caregivers, and we figure out what is the need in that community. And then we have a standard footprint for efficiency in the building, which creates efficiency in staffing, which creates efficiencies in supplies. So those become fixed costs. And then we're able to have more time for the creativity piece of it. What does the market need there? Do they have a joint replacement program that we need to be a great partner for? Do they have a spinal program that we need to be a great partner for? So for us, we're great at rehab, but how can I help that community and those people to have great outcomes and get back to their life, which is the whole purpose of inpatient rehab.
Yeah, well, actually what I'm hearing is value-based care, right? And a lot of growth comes from really good care, and there's a lot of organizations that aren't making it because they're underwater financially. And you've got such a great background, right? When you think of clinical and business and how those merge, and compliance, and how you've been able to grow through that lens. I know you've seen so many challenges in healthcare, which is, I think, challenge in healthcare synonymous these days. So, yeah, what have been the most significant roadblocks that Exalt has faced, and how have you been able to overcome and navigate those in order to succeed?
I think some of the challenges for us are not internal based. It's responses that it takes 6 to 9 months sometimes to get on a managed care contract. You have to get all your ducks in a row, per se. That you have to have a license. Well, it takes a minute to get your license. Then you have to get your credentials and you have to get certified. So then you can apply for Medicare. Once you have a Medicare number, you can apply for the payers. In the meantime, you still are providing care. You're still building your core business. So for us, those efficiencies I was just talking about help you to not have all that exterior noise and stay true to your focus and your purpose. So for us, that's kind of been our playbook of do the critical few really well, and then everything else comes in waves, and you don't have to be everything to everybody, and you know what's coming, you prepare for it, you don't have surprises, and then we're able to pivot when something weird comes or something new comes. You're able to say, okay, we can put the resources to that because we already know what our trajectory is. We already know what the order of our steps are.
And with that, right now, you have to innovate. In healthcare, it's light speed right now. So what things, as you look ahead, are you planning to do with Exalt in innovation within this niche?
I think for us, it's You don't have to have shiny. You don't have to have the latest and greatest.
Yeah.
It's staying true to exceptional care, incredible outcomes, great patient satisfaction scores, being an appropriate partner in the community, being the great place where your physicians want to come and practice, where they have the freedom and they can use their clinical judgment to do what's best for the patient. And for us, that's always been what worked. So we do have state-of-the-art equipment. We have incredible therapists who do wonderful things with our patients and their families to get people back to high-level functioning outside of our doors. Our nurses give wonderful care. They take care of the wounds. They take care of the daily activities that people still need help with. But by doing all of those core things well, then it gives the person so much freedom and so much time in those 14 days that they're generally with us to get back to what they consider their quality of life. Yeah. And that's important because I can have goals for someone, but their goals are different. And I need to listen to what their goals are and really help them meet them and not just say it.
Yeah, well, care delivery is really what's going to make healthcare survive or not. And, with all of the technologies, the innovations, everything, through the revenue cycle is so complex. Is there anything I may have missed? If there's, if you're talking to your peers and you say, hey, here's 2 or 3 takeaways that I could really give you from my expertise on the impact of good care delivery, what would that look like?
I think for us, it's always been, what is the playbook? What is your core values? For us, it's exceptional care and compassionate care for every person, every time, not most of the time. It's saying, what was our patient satisfaction scores and what is it that we need to work on? And being honest with ourselves if we missed the mark. And saying, in this hospital, what does this building need to do? What does that team need to do? Or when that team does a great job of it, how do we figure out what their magic sauce is and share it with others who may be struggling in that area? And then staying true to your purpose and what you said you were going to do. If it's inpatient rehab, then let's not start an outpatient XYZ product when we're an inpatient business.
Yeah.
And then we work really hard to attract great talent because we are in a people business and we want people to be able to provide the great care that they want to provide. So for us, it takes that human resources piece and the people piece to let them grow. It takes the physician piece and saying, this is the environment we work in. Do we have everything that you need to practice medicine here? And then, as I said a minute ago, is then listening to our patients. What is it that's your goal? So using that 3-pronged approach with a very standardized, efficient model of care delivery really seems to work successfully for us. When our buildings, of the 10 that we are in process with now, 9 of them, the footprint is the same. Our operators listened to me as a nurse and said staffing is weird when you have these issues. So our buildings have a set number. It makes staffing very easy. Nurses don't have wasted steps. The operators did a great job thinking about the clinical processes. So we really think that we have a great set of rules and a great vision to go forward.
Well, I would think so, given how successful it appears to be going. So thank you so much, Kim, for your time. I really do appreciate it.
Thanks for the conversation.